My main focus is working with people who have endured narcissistic abuse and trauma. And to tell you the truth, I work with anybody that is willing to work with me, pretty much when it comes to trauma. Well, I keep falling into people that are dealing with narcissistic abuse and trauma.
Okay.
And I've also run into a lot of people who are dealing with betrayal trauma where their spouse has been cheated on by them as well. And EMDR is a great way to help people with that.
On this episode of the CompassionWorks Way, we'll hear Jordan speak to Jonathan Taglione. Jonathan is the founder of Positive Approach Counseling. He established the business in 2016 because he believes in counseling, in the community, and in his clients. Jonathan is skilled in providing mental health-related services, including life coaching, EMDR therapy, cognitive behavioral therapy, and conducts sessions for individuals and groups. His journey and experiences have allowed him to become an expert in many treatment modalities. Jonathan emphasizes the development of healthy, useful life skills, and he not only tailors his services based on the client's needs, but also incorporates intervention into both his group and individual processes. In this episode, Jonathan shares his thoughts on starting a private practice and what areas of counseling to focus on. You can learn more about Jonathan by visiting his practice's website at positiveapproachcounseling.com. Now let's get into the episode. Welcome to the CompassionWorks Way, featuring insightful discussions, inspiring stories, and expert interviews on mental health, building your practice, and personal and professional growth. This show is brought to you by CompassionWorks, your hub for therapists, mental health professionals, and seekers of holistic healing. Your host, Jordan Schaefer, founder of CompassionWorks and licensed EMDR therapist. Together, we'll create a world where compassion and understanding transform lives. CompassionWorks, empowering therapists and transforming lives. Now let's get into the episode.
Okay, well, so I'm here with John Taglione, right? And
Jonathan.
Jonathan Taglione. And you're LPC?
Yes, I am.
MS or MA? What do you do?
Masters of Science, Counseling Psychology.
Okay, good.
Yeah.
Where'd you
graduated
go to school?
I graduated in 2012 at Tarleton State University.
Oh, you did? That's the one in Stephenville?
Yeah. Yes, but I actually went to a satellite campus in Fort Worth, and they had a counseling program over there, and then I would just commute from North Dallas all the way to Fort Worth and back, to go to grad school.
Okay. So, and what year was that again? Did you graduate?
I graduated in 2012.
Oh, 2012. So you've been doing this a while then. Well, did you start counseling right away, or how did that go?
Well, I actually worked for a hospital, and then I realized that I wasn't a good fit until I jumped over to the Excel Center of Louisville, where I would work with teenagers dealing with depression, anxiety, and trauma.
Okay, and so you worked there for a while, and then from there, did you start your private practice, or?
No, here's how it went. I went from, my first hospital, I worked at Sundance Hospital, then Texas Health Resources, then Millwood Hospital, where I worked at the Excel Center. And then I realized that since I was working PRN, Jordan, I was only getting a certain amount of hours. So I worked outpatient, then inpatient, and then I transferred over to Carrollton Springs Hospital, where I would work with adults, and then a psychiatrist office. And then in 2018, I decided to transition over to private practice.
Okay, so you did a lot of different things before you went into private practice, right?
Yes,
sounds like
correct. Yeah,
and it sounds like you found mentors along the way. Was that part of what your strategy was?
Well, yes. To tell you the truth, I met one mentor, and her name was Summer. And right now she works at Changes in Frisco. She was a good mentor for me over at the Excel Center. During my time over at Millwood, I was dealing with a trauma in which I lost my confidence into being a therapist. And my mentor, Summer, really helped me gain my therapy legs back so I could get started and work with teens, dealing with that.
Is that your main focus, working with teens, or what is it now? Is it?
Well, my main focus is working with people who have endured narcissistic abuse and trauma. And to tell you the truth, I work with anybody that is willing to work with me, pretty much when it comes to trauma. Well, I keep falling into people that are dealing with narcissistic abuse and trauma.
Okay.
And I've also run into a lot of people who are dealing with betrayal trauma where their spouse has been cheated on by them as well. And EMDR is a great way to help people with that.
Okay, that's great. So tell me, what are some tips you might give to someone who would want to start a private practice, and kind of, or what was your approach, or how did that unfold? And then we can talk about EMDR and trauma and that kind of thing.
Well, I'm sorry, you kind of cut out there. What was your question?
Yeah, well, what are some tips you might have for people who would want to start a private practice?
Okay. Well, the first tip that I would suggest is that find a specialty in what you want to go into. That's the first case. Then develop a business plan in how that will, benefit the community that just started out. I mean, is it a new community that's developing? Is it a need that is needed and stuff like that, I would say. Then on top of that, when you're first starting in private practice, if you're not sure with what specialty you want to go into, try many different things and work with people and find mentors that have specialized in that are willing to carry you under their wing to give you some tips and pointers and stuff like that. Also, when it comes to private practice, I would say that you cannot be afraid to make mistakes, because you are going to make mistakes along the way. And what better way than to just learn from them? Also, the other side of it too, when it comes to private practice, make yourself a good website, because that is like having a nice haircut. You want to look good so that you can draw clients in. And also, don't be afraid to take on insurance, because that is a great referral source for you to have clients coming in.
Okay, so you take insurance? I've always taken it, or how did that go?
Yes. Well, when you and I were talking, I had a friend by the name of Coslin Young who helped me get paneled for insurances, Jordan. I tried to do it on my own through CAQH, but that was a total nightmare. So I had I had Coslin, who was a medical biller, help me, and she had experience in that. And she got me paneled for Cigna, Aetna, United Healthcare, Blue Cross Blue Shield, all the main insurance companies, in order for me to have a ready supply of clients coming in,
Okay. And so while you were doing that, were you able to work, or were you working in the hospitals then, or how did the transition go from working, I guess, for other people, or
Well, I had a mentor who, while I was working at Mech Healthcare and Associates, Shane Adams, who runs the Center for Marriage and Family Counseling, he actually had his own private practice right around here on Parkwood Boulevard. And he would mentor me about private practice and how wonderful it is to go into.
Okay.
So when Mech Healthcare and Associates lost their ability to, continue to afford me, I just decided to take that leap of faith, and jump into private practice, And the first 2 years were not really profitable because I was still trying to figure out, certain things. But I just kept my head down and I just kept on plowing forward. And with insurances and stuff like that, profit has definitely gone up, and I'm seeing at least 33 to 38 clients a week.
Okay, so you're busy. So when you take the leap of faith, what's the next step? I mean, do you rent an office or how does that go?
Well, I would say that where I'm currently renting an office from right now is through someone else who's in mental health. His name is John Dakin, and he runs Aspire Recovery right next door. And basically, I'm renting one of his offices, and the more clients I see, I was able to bring on another therapist in which we rent another office from him. And I'm trying to bring in another therapist too, so I can have two therapists working under me. So,
okay.
Yeah.
Now, are these therapists fully licensed? Are they interns or what? How does that go?
Well, these therapists are fully licensed. I've been working with another therapist by the name of Jennifer Job, who is trained in EMDR but not certified. And she's been in private practice for approximately 8 years now. And she's been working with me for about 7 months, and she works with people with trauma and narcissistic abuse as well, and she's done a great job. So to, I guess, answer your original question, when someone in mental health is, trying to get their caseload up, but they are not seeing as many clients in the office, you can work out a deal with someone so that you can sublease from them and slowly build up your caseload from there.
I see. Okay.
Yeah.
In terms of accounting, do you have an accountant? What do you do about that kind of thing?
Yes. Well, Jordan, I'm really not much of a math person. So, me and taxes, I've actually had to hire a certified public accountant and stuff like that. And he keeps my books clean, and doing taxes yourself, in private practice can be very complicated. So that's why I, just dish it out to my accountant, Dennis Chu, and he's yeah.
And then how about things like scheduling? Do you do your own scheduling, or is it done online, or how's that go?
Well, I use practice management software called Simple Practice, and they do charge a lot, but it's totally worth it. So through my website, that I created through GoDaddy, I actually have people getting directed to my website. They read my profile and then they call me. And then while I have a conversation with them, I pull information from them, and then I upload their client information on practice. And through there, they get a confidential email from Simple Practice where they click on a portal link and they fill out all the admission paperwork. It makes the process a lot faster and cleaner. So, yeah.
Okay. And then they schedule through that? Is that how they schedule?
Yes, they contact me through my phone number, and then if my caseload is full, I give it to Jennifer, or if my caseload is light, I take on, the client, and I put them in my schedule through Simple Practice.
Okay.
So
you schedule them in, though, I guess is what I was wondering.
Yeah.
Okay. Right.
Yes, I do.
So anything else about the nuts and bolts of a private practice? Do you work?
Well,
what do you think?
The biggest thing I've got to do is you can't be wrapped up in how many clients you see a week, because then if you're starting out very slow, it could become self-defeating. I would suggest more than anything is being patient with yourself and giving yourself some time to grow. Everybody has a vision and how they want their private practice to be. Give yourself some time to let the dream grow. It's kind of like a mustard seed. It's very small at this point in time, but eventually, if you have faith within yourself, it'll grow into a big tree. Trust me,
Okay.
And then it'll just get even bigger and better.
Okay. So then, tell me about EMDR. You started EMDR in 2017 in there. Had you had a private practice before that, or I guess not, right? So how did EMDR change your counseling, right?
Well, to tell you the truth, Jordan,
Okay.
I would say that I did start EMDR in 2017. And to tell you the truth, I would usually use CBT in order for me to work with my clients. And in the hospital, I just felt that CBT wasn't enough, So originally, when I first heard about EMDR, it was when I was working with a client at the Excel Center in Louisville. And she was a teenager that had undergone a rape at the age of 13 by her father's best friend, And she told me the story about what happened and what EMDR was like. And after her sessions with her individual therapist recommended her to go into the Excel Center in order for her to get acclimated back into, socializing and connecting with people that have been through similar traumas. So when she told me about EMDR for the very first time, Jordan, I was very fascinated with how it worked. And she showed me and told me a little bit about it. But I wouldn't encounter EMDR not until very much later, in which Dr. Mack actually encouraged me to go after the training.
Oh, he did?
Yeah.
So the person who started you on it, though, was a client who knew about it? Is that what you're saying?
He told me about it.
Okay. Then Dr. Mack encouraged you.
Yeah, to go through the training.
Oh, good.
Which, to be honest, you always encouraged us before the training to read the book. I didn't read the book,
Yeah, okay.
But, I went and stuff like that. And I have to say that on that Monday morning, I actually used some of the skills and techniques that you taught me, the container exercise, resourcing, and the light stream with the first client that I've ever that dealt with a heavy trauma. She was this woman who was going through a full-blown anxiety attack, So when we started to use the light stream, things started to really calm down, And she was someone who was shaking and crying uncontrollably, and she couldn't really verbalize with what's going on. So Dr. Mack had me come in and meet with her, and I used these EMDR techniques, and they worked phenomenally well. What happened next is that she felt like that she could trust me, and then we developed a rapport, in order for us to start my EMDR journey, and she was my very first client.
Okay, good. So that's okay.
Yeah.
And,
yeah. She's actually for my logo for Positive Approach Counseling, because when I do EMDR and we get through the traumatic memory, I see positive turn, where it's pretty amazing. It's like a miracle has just unfolded and happened,
Do you have any idea on how EMDR does that? Have you any thoughts on that?
Well, I would say that with EMDR, what it does is that it desensitizes, traumatic memories through eye movements, and we reprocess it, by changing the negative cognition into something more positive.
Mm-hmm. Okay, and you think that's part of how it turns positive then? Something in the process happens, yeah. Okay.
Well, it is, I think, the memory unit, because the limbic system and the short-term memory system are all tied together, right?
Mm-hmm.
So through eye movements, I believe that by the eye movements, it desensitizes the memory, in which eventually the client can say, yeah, it's just a memory. It doesn't distress me as much as it did before.
Okay.
So.
And in that, then, you call it positive approach counseling? Is that your business?
Yeah, that's my private practice.
Okay, good. So you went from doing mostly CBT then to doing more EMDR, or how did that go? Was it a slow transition or pretty big?
Well, it was, like I said, when I worked with this client, at first, my skill into doing EMDR was not very strong. But I remember, Jordan, you're encouraging us to say, yeah, just go out there and give it a shot and everything like that, So when I followed your words, I just gave it a shot, and it just became like, second nature, and it was amazing to see how she transformed. So I started to do more EMDR, and I was encouraged by Carolyn Burleson to actually go through dialectical behavioral therapy as well.
Okay.
So now with my practice, I just put CBT on the side and focus on DBT and EMDR. When it comes to trauma, I was mentored by Carolyn Burleson to really take a good hard look at DBT for trauma. And it's another certification that I have along with EMDR. And CBT is just something that I use. That's just my base therapy that I've used before I even worked on EMDR, But it's just something that I go back to in case, a client wants to talk. I hit things logically, but then, I use DBT in order to help regulate those emotions in case they get trauma triggered, So, yeah.
And that's the dialectical behavioral therapy, right?
Yes,
and
that's
then
correct.
The other one's cognitive behavior, which I think most people start out doing that. So with the DBT, and your license, how does that work? You take trainings in it, become certified in it? I don't know how that goes.
Well, I went through this 3-day training with Pesci, and basically what it was is that you just go through what DBT is and what good methods that you could use in order to help out your clients. And basically, when it comes to dealing with people that are dealing with trauma, I say that the TIP method that they use is actually quite effective, especially when someone's going through a traumatic response. So the TIP method is basically used for regulating your emotions and bringing your emotions down. And TIP stands for temperature, in which you lower your temperature down, taking cold ice showers, which really helps activate the vagus nerve. The I is basically intense exercise. So I'll have clients do push-ups in here, so they'll do 20 push-ups and rest for 10 seconds and then get back on it again.
Oh.
And I always ask my clients, you never thought you'd be doing 60, 80, or 100 push-ups in here for a therapy session? And they go, No, I didn't. But they smile at the end, Jordan. And it's like that, wow, I'm capable. I am powerful, which is one of my favorite things to see, And the P for the last part of tip is basically your standard progressive muscle relaxation,
Okay, and so you do that with folks too. Okay.
Yeah. And, I'm not really sure if you do this too, but I actually use sour candy, when someone has an abreaction, I get them to use these warheads and stuff like that. And I get them to talk about what's going on in their mouth in order to keep them grounded. And sour candy actually really works,
I never heard of that one.
Yeah.
Okay.
Yeah. And I also went over to Buc-ee's the other day, and I also got them to use hot sauce as well, too, in order for them to calm their emotions down as well. Carolyn Burleson got me to use this EMDR treatment plan. And when we go through these traumatic memories that they want to work on, the sour candy, the hot sauce really does work, and it keeps them grounded, which is pretty great, So, yeah.
Okay. The treatment plan, what is that? What can you speak to it a little bit?
Well, the EMDR treatment plan that Carolyn Burleson taught me is that there are 5 boxes, and the 5 boxes are the 5 things that they're working on. And so if they're dealing with depression, anxiety, and trauma, what they do is they think about depressed memories or traumatic memories, and it goes into this timeline, where I ask them how old were they when it happened, and I do a quick snapshot of what was that memory and what was the most distressing image with that. And then we go in a little bit deeper into, okay, how does this memory affect you today? And if we were to resolve this through EMDR, how would this help you make your life better? And it's basically a nice map to follow through,
Okay. And you set that up before you start doing the EMDR processing. Okay.
I usually do that within phase 2. Phase 1 is I just do intake and get to know them. And phase 2 would be like teaching them coping skills while doing that treatment plan as well.
Okay.
Because I'm prepping them
to
get into something deeper.
Okay. So then, regarding then if there's new therapists coming out really every year. And my experience coming out of school was I thought I knew more than I did, but realized that there's always more to learn. There's always workshops, and it's endless, right?
Yeah.
What would you recommend people do?
I would recommend that, therapy is basically like martial arts. There's basically over 150 styles of martial arts, just like there's probably numerous theories out there. Okay. I say when you graduate from grad school, it's always important to keep an open mind and constantly learn. Just because you graduate with a master's degree doesn't mean that, your journey ends there. It means that you still have to be hungry for that knowledge to help as many people as you possibly can. And you have to throw out this idea that there's one perfect solution for everybody, because that just does not work,
Okay.
And in personal experience, I've always learned that it's always that no matter what fancy theory you use, it's always best to have 6 ears and 1 mouth, because listening is the most important thing in your toolbox.
Okay. And with that in mind, are there trainings you recommend, or I mean, I think you're into EMDR and also the DBT, and then I guess what people are interested in, you would recommend they follow that as well, right?
Yeah,
What they're
yeah.
drawn
I mean,
to.
like, try to get as many. Say what?
I mean, what they're drawn to. Yeah, but go ahead. Try to get as many what?
Well, try to get as many certifications as you possibly can. If trauma is your interest, be like a mad scientist. Be like Victor Frankenstein when you're just like have this amazingly hunger for knowledge and stuff like that, where you want to consume everything. Learning is also learning even further and going beyond, what you've already learned. So it's always good to have that. Personally, I recommend your training to do basic EMDR. I think back and I think about your training, and you were telling jokes and you were also funny and stuff like that, but you always encouraged us to always just give it a shot and not be afraid, And that, I think that when I work out with my first client, that was so important for you to give us that life advice,
Okay, to jump in and start doing it and go for it. Okay, good. Well, that's great to hear.
Yeah.
Yeah.
Okay, well, I definitely do recommend going through the EMDR certification training because, I mean, it's just adding more skills to your tool belt, and it makes you a better therapist in the long run. The training is great, but going after that certification piece is something more that I recommend other therapists to go through. So, yeah.
Okay. And you are certified now, is that correct? You're EMDR?
Yes, I am certified.
Okay.
Mm-hmm. Yeah.
Okay. Well, thanks a lot. I think we've covered a lot of ground and had a chance to wrap up here. So I appreciate it.
It was my pleasure. You're actually the first person I did a podcast with. So, yeah, I was a little nervous to do this.
Well, easy going, right?
Yeah, you make it very, very easy. So, yeah.
All right. Well, good.